protocol having been established, I still want to say a couple of thank yous before we get started. My first thank you is to President Harrison. And President Harrison, it has been absolutely a joy to watch his calm, wise leadership through this whole week. And Congress President, thank you so much for your strong stewardship to bring us into this 65th year. And with all the challenges of COVID, that's no small feat. And I am very grateful to you for that. Madam President, I am so grateful to you. You have shown me nothing but friendship and kindness since the day I have met you. That is so precious to me. I can't even tell you what it has meant. So thank you for allowing me to come and speak to you, this invitation. So I got an assignment, and for those of you who are teachers and pastors, you know what that means to get an assignment from the dean. So let me just start off by introducing myself. My name is Kelly Sherrer, and Dean Sherrer is my wonderful husband. And ordinarily, I am very happy to stay in the background. I feel very comfortable there and supporting him and his Just a Voice ministries. But in my day job, I also have a day job, and in my day job, I'm a medical doctor. And so I have given a lot of talks to professional colleagues, but this is the first time that I have spoken about my faith. And the dean has approached me a couple of times about doing that, and of course I push back every time. But I trust him and his judgment so deeply that I am stepping out, so I trust him. And I also trust the OBSC family to catch me if I fall a little bit right now. I'm going to be honest, I'm nervous and I'm excited all at the same time. But let's start. I'm not just a medical doctor, I'm a specialist. So as I was mentioning to a couple of the children's groups, Sister Sue's group, some doctors specialize in the heart and the kidney and the lung. I specialize in the eye. And when you specialize in the eye, it's called an ophthalmologist. And we do eye surgery. People who have cataracts, crossed eyes, have eye injuries. That's what we do. And it takes a while to become an eye surgeon. It's 4 years of college, 4 years of medical school, 4 years to train to be an eye specialist, an eye surgeon. So it's 12 years after you graduate from high school to learn how to do that. So for me, for my 4 years of college and 4 years of medical school, I went to Harvard for 8 years. And then, thank you. And then to specialize in being an eye surgeon, I went out to Stanford and spent 4 years there. And so then I decided, because I was a glutton for punishment and liked to go to school a lot, I decided to be a specialist in eye surgery. So I specialize in doing corneal transplants. So I've retired from doing that now. I don't do that anymore. But the cornea is, the front surface of the eye is not really the brown part of the eye. There's a tissue that sits over the brown part of the eye. It's called the cornea. And the cornea is like the crystal in your watch. If it gets scratched or you wear it in the shower, it gets steamed up, you can't read it anymore. Same thing in your eye. If there's a scratch to your cornea or scar there, you can't see anymore, and that needs to be transplanted. So under the microscope, it's all microsurgery. You take a very precise blade, you cut that out, and you suture it back into place with sutures that are far finer than a human hair is. So it's a very delicate surgery that is done. I love my work. I love what I do. I'm very fortunate in that. My family thought it was strange that I went to school all those years to specialize in the cornea that's 500 microns thick, but yeah, go figure. Anyway, I was fortunate enough after all that training to be considered one of the best cornea surgeons in the country. And, I had people who would come to me at Stanford when I was out there on the faculty from other countries for their surgery. When I practiced in Maryland, I had patients who were astronauts, and something special really happens to the eye when people go into space. I had Nobel Prize winners who were patients of mine, and generals from the Pentagon, and a game show host that if I said his name, I'm sure everybody in this room would know who it was. I was really blessed. I loved my work, and things were really going well. But have any of you had a time in your life when everything seemed to be going well, perfectly? And then, I have been really blessed. I had wonderful parents, wonderful, wonderful people, God-fearing. They loved each other, they loved us, and at a relatively young age, they both got sick at the same time. And to the point where they couldn't take care of each other. I tried everything I knew how to stay in my practice in Maryland and come back and take care of them. And everything that I knew wasn't enough. And like Pastor Harrison was talking about, the kind of parents that would give up everything for you, they were that kind of parent. And I could not let them go into a nursing home. I could not do that. So I packed up and came back to Cincinnati. And I moved into their house for 5 years and took care of them. And I was the kind of girl where I was a daddy's girl, and I called my mother twice a day, no matter where I lived in the country. So to say I was very connected to both of my parents was an understatement. But when I moved back to Cincinnati, I saw three things while I was taking care of them. The first thing I saw was what it was like on the other side of medicine, what it was like to be a patient instead of a doctor. And it was humbling. It was very humbling to be at the mercy of sitting there waiting for the doctor's decision. I had not been in that role when I was on the other side of things. The other thing was my parents had good insurance, but I'll tell you what, and they had a daughter that's a doctor, they encountered racism in medicine just about everywhere they went. And that made me angry. And the third thing that I really struggled with was my parents were really good people. They were really good people. And they suffered. And I was confused because I didn't understand why God would let them suffer that way. And to tell you the truth, I still don't understand that. That's the piece I still don't understand. But my parents, they passed away. They did pass away, and they passed away pretty close to each other. And I didn't get a chance to grieve one before the second one died. My mother died. I thought she was getting better. You know, I was this great doctor, I was gonna get her better. And we thought she was, but one day we were standing there talking, and my mother just dropped to the floor and she died right in front of me. And I'm just gonna tell you, if you think it's hard for a doctor who thinks they can fix everything and cure everything, but in the people that I love the most, I couldn't stop their suffering, and I couldn't save them. I couldn't do it. So I had really done everything that the world told me you needed to do to be a great physician. I've gone fancy schools, I had fancy patients, I had recognition from all around this country and even outside of this country. The people that I loved most, I was helpless. And I really came to the end of myself at that point. And I really went into a dark time. I tell you, I did. But the Holy Spirit was with me the whole time. And I was in that dark time. And during that time that I was trying to put the pieces together in all of this, I knew I was a great physician, but I spent time with the great physician. And after that period of time, I knew I could not go back to my fancy practice again. I couldn't go back. I had experienced too much, I knew too much, and I knew that I had to leave that practice behind and focus my care on people who look like me, people who suffered disproportionately with disparities. And so my career changed a great deal at that time. And what I do now, and you know, what I want to mention is President Harrison said it so beautifully when we were in class, is sometimes adversity is preparing you for the next thing. And what I didn't realize was that adversity was really preparing me for the next thing, which is what I'm doing right now. I'm medical director of the outpatient clinics at the University of Cincinnati. And my patients that are there, you know, I used to have patients bring me big fancy gifts and everything. Patients I have now have a hard time getting bus fare to come and see me. It's different, and I love them. I love every day that I'm in there with my patients in there. I can't even tell you. The other thing that I do is to make sure that the doctors who are in my clinic understand how to take quality care of people who don't have transportation, who don't have insurance. And I also teach the medical students at the University of Cincinnati. And I teach them about health equity. That's what we talk about. It's a good thing. It's a good thing. Yeah. And we go into the deep to talk about health equity with those students. I'm not going to go really far into health disparities and talk about it, because I know Sister Carletta talked to you about that a few years ago. And I just want to say a few things. I think some people think that those disparities are a long time ago, back, you know, in slavery or something. They're today. They're today. You know, so people talk about, for instance, let me tell you two things, and then I'll move on. First thing is, some of you may have heard of Marion Sims. I'll tell you about him. He was the first president of the American Medical Association, father of OBGYN. And the way he became the father of OBGYN back in the 1800s was that he did surgery unanesthetized on slave women. That's how a lot of the modern techniques that are still used in OBGYN, that's how they came to be. And if you think things have changed, think about Serena and how close she came to the end of her life during her pregnancy. And just recently this summer, Tori Bowie. And what happened? Those things are not remote. They're right now. They're issues for us right now. One other thing I'll just mention and move on is the whole role of having Black doctors, Black nurses that are at the table when these decisions are being made. I'm going to tell you quickly about a study that was published in 2020. You know, Black infants die at a rate that is multiple of what white infants die. That's just fact. So they looked at 2 million births down in Florida, just published in 2020. Here's what they found, was that Black infants died at 3 times the rate of white infants. Fact. But if those Black infants had a Black doctor, it was cut in half. So those Black doctors didn't have special equipment or x-ray vision or anything. They just had compassion and integrity. And that's why those disparities are still important. But I want to come back to talk about visions. That's why I'm here today. You know, we have disparities in kidneys and high blood pressure and diabetes. Everywhere you look, the rates of our disease is higher. everywhere you look. But since I'm an ophthalmologist, we're going to stick with the eye, so I'm going to come back to the eye. So I was particularly pleased when I heard that the youth were going to be working on vision boards. And as I've worked in ophthalmology, I have found that many of the things that place your physical vision at risk run the risk of putting your spiritual vision at risk. And so I was really excited when the young people were working on their vision boards. I love vision boards. For those of you who don't know about vision boards, they are physical posters that represent the things that are on your heart, what you want for your life, where you want, what you value in your life. And I had a special treat. I went into the Reverend John and James Jones session this morning, and all of their students went through and showed me their vision boards, and I saw people going to college, cars, nice houses, people who wanted good friends around them. It was a very positive, powerful thing to watch that. I'm going to share a little bit with you. Sister Sue? Yes, Nyla? And your crew, would you come up and share this is a fantastic vision board. All right. So this is Sister Sewell's class, wonderful class, and Nyla, would you do the honors of telling everybody here all the wonderful things that you have on your vision board?
So I said I wanted to go to college for like film, to be like an actress. And then I put all the like black girl stickers because a lot of black girls my age or older, they struggle with like body positivity and like hair positivity. And I just like wanted to like show that and like make me feel comfortable in my own skin and who I am. And then I said that I wanted to get good grades this year and travel more and save more money.
So they are beautiful. They are beautiful. And what I would say is it's beautiful for our children to do it, but if you're in your 40s, 50s, 60s, 70s, you should continue to have a vision board. I would really strongly encourage you to do that. But I want to talk about some things that are related to vision and vision diseases that will stop people from getting what's on those boards, because we all know people who either had boards or dreams of buying a business, going to college, and it didn't happen. It for whatever reason, it didn't happen. And so we need to think about what are those things that get in the way and block people's vision, that compromise their vision. And so on the handout that I sent around, I have my 6 uns. 6 uns. Unprotected, unexpected, unclear, unfocused, unfair, and unaware. So we're going to run through that because there are different conditions that affect your vision. I'm a doctor, I want you to get to the doctor, make sure you don't have that problem. But they also run the risk of blocking you from achieving your spiritual visions as well. So let's talk about unprotected. And I'm going to start off by, and I've changed the names of the patients and switched them around. I'm not divulging anything, but we're going to start with a patient that I've been seeing over the last month. She came in with infections in both of her eyes, vision severely down, and those infections came because she had not been wearing her contact lenses properly. Contact lenses are a real risk when you don't handle them properly. But what was interesting about her was when she came in, she was very angry. She was very angry. And she's about my age, old enough to kind of be on better behavior, and she wasn't. And people were drawing straws because the nurses and technicians kind of wanted to not interact with her. And it seemed like the harder we tried to make her better, the angrier she got with us. And then one day she came in, about 2 weeks ago, and she was calm. She was calm. And so everybody was wondering what happened. Well, here's what happened was, because of COVID, this was her explanation, she had missed all of her appointments to come back and be checked. She had been buying her contact lenses online and replacing them. And those contact lenses are supposed to be replaced every 2 weeks, but they looked pretty good to her. So she was kind of wearing them until she got around to changing them. And so she was angry, but when she came in calm that day, she said, you know, Dr. Kelly, I go by Kelly Sherrer. She said, Dr. Kelly Sherrer, I realized I was mad at the wrong person. I needed to be mad at myself because I knew better. I knew better, but I was expecting things to be okay anyway. And so when you're thinking about your own visions, where you want to go, how many times have you done the wrong thing, but you're still expecting a right thing to happen at the other end of it? So you better, when you have something that you value, you need to protect it. If it's your precious dream, you need to protect it. And the other thing about unprotected is you need to make sure that you have preventive care, because that allows for early detection of things. So in your spiritual life, if you're praying, then if you're outside of God's will, you know it early. You can early correct. And so, well, let me move on to the next one. Okay. Let's talk about the unexpected that can get in the way of your vision. So, eye injuries are far more common in African American communities. And eye injuries, orbital injuries, is when you take a blow to the eye. And that can come from car accidents, physical violence, all of those things are orbital injuries, and they are more common in our community. I'm going to tell you about two patients real quick. One of them was a patient who, in 2020, was protesting. You know, that was the year of the murder of George Floyd. And this patient had been in a BLM protest in downtown Cincinnati, had been hit by a rubber bullet, and she has sustained permanent damage from that injury. That falls into the category of injury that you didn't provoke, you didn't bring on yourself. I have another patient who was playing with some fireworks that same year and had a very bad injury to that eye. And that was an injury that some people would say that person kind of brought on themselves a little bit. But when you are a medical doctor, you gotta treat everybody the same. You know, I can't go in the room and start judging who was responsible for the injury and who wasn't responsible. A doctor's job is to go in and care. And so I just ask you as the church, when somebody is reaching out to you, do you stop and ask them, did they bring that tragedy on themselves before I decide whether I'm going to help them or not? Or do you just help them? All right. So the unexpected, I just ask you to reflect on that a little bit. Those are the things that can take you off course, and it's good to have a plan B when the unexpected comes along. So now I want to talk to you about the unclear. Unclear is cataract. So now, cataracts are really common. I got my little, all teachers have one of these, I'll let you know. Okay, so behind the colored part of the eye is the lens of the eye. And when you are born, that lens is crystal clear. In fact, it's called the crystalline lens. Pristine, just like when you're born as a baby, you're pristine, absolutely clear. But each decade of life, that lens becomes a little more cloudy. You pick up the baggage of life, and it just comes along with living. Just comes along. I have a patient that came in, and he was 60 years old, and he had a white cane with him. The residents, the young doctors that I teach, said, I think we need to do cataract surgery. I said, wait a minute, people don't come in with a white cane if they need cataract. But no one had done the necessary test on him to understand that a cataract would have brought his vision back. So this man walked around for almost 4 years with a white cane for a surgery that takes about 15 minutes to do. And so this happens to us sometimes as African American people, okay? So we did a surgery, and his vision was restored to 20/20 in one eye, 20/25 in the others. His life was completely changed. But I raise this to you to keep in mind that, you know, when we're looking at our visions and we're young, we can see it real clear. Just like a baby with a crystal clear lens, we see it real clear. But then we pick up baggage along our life. Things that kind of slow us down. And then after a while, all of our visions and hopes for ourselves, they just get hazy and cloudy. We don't see them clearly anymore. So surgery for those spiritual cataracts is what we're doing right now. You know, you come right here, and it helps to restore the clarity. Some of that baggage that you picked up over the course, particularly over the course of COVID. All right. Okay, let me move on. The next thing I want to talk to you about is unfocus. Unfocus. The disease I want to talk to you about is macular degeneration. And so, for those of us who are old enough to remember an old-fashioned camera had film in it, the retina is like the film in the back of a camera. It captures all the image. But there's one space in the retina, that allows you to have your sharpest focus. It's called the macula. And so you think about it, when you go to read a book, you don't hold the book over here. You hold the book right here in front of you to read, because this is where your sharpest vision is. That's where your macula is. And people who have macular degeneration, it's usually older people, they get deterioration of that macula. They can no longer focus. They look, they can have things in the periphery that distract them, but they can't see things straight ahead. I'm going to talk to you about a patient who's not an African American patient, but I was going in the room to see the patient, and the junior doctor said, "Doctor, be careful with this one." So I know what he meant. So I went in the room. Patient had a big old skinhead tattoo on his arm. All right. So this was in COVID, where we were the only shop in town. This patient needed treatment for his macular degeneration. And he wasn't the one who had to focus. I was the one who had to focus, okay? Because I knew that I needed to stay focused on what I needed to do as a doctor and not get distracted. So I'm not saying I agree with any of his philosophies. That's not what I'm saying. But one thing I do want you to think about is how often we get distracted from helping people. So, you know, sometimes, and I'm not going to stay here long, sometimes we get involved in what somebody does in their life or what their pronouns are and all kind of stuff. We get distracted. Our job is to care and help. and not to get distracted by all of the other things that are around us. So that one I call unfocused. All right, so I've been around. Give me 3 more minutes. Well, not 3. All right. Okay. All right. Unfair. How many people have felt like they have earned, they deserve, and they don't get? I think probably all of us. I know I have. Well, glaucoma is a chronic disease. Is when the pressure gets too high in the eye, and there are delicate tissues in the back part of the eye that won't tolerate a high pressure like that. You can't cure glaucoma. There's not a cure for it. You treat it, you take drugs for it. But what's unfair about glaucoma is there's not anything you do to cause it. There's not anything you can do to make it go away. And it affects black people 8 times more common than other people. It's unfair. It's unfair. And I'm not going to bring up a specific case because I see so many patients with glaucoma because it's so common. But I just want to, first of all, encourage you, if you haven't been tested for glaucoma and you're over 40, you need to put that on your list. You need to put it on your list to get checked for glaucoma if you are over the age of 40. Because if you ask me what the symptoms are of glaucoma, it's nothing. That's exactly what the symptoms are. By the time you have symptoms with glaucoma, the horse is out of the barn and down the road. You got to get checked in advance. But for your spiritual vision, what I would just suggest to you is, we all have run the risk of being overwhelmed by things that seem unfair. And we talked so much this week about the value of having a support system, a community of people that hold you when the unfair things, so you can't make the unfair things go away. They're going to happen. But who's going to be there for you? What support are you going to have when those unfair things happen? And with glaucoma, there's medicines, there's drops, there's things that you can do. You can't cure it, but you can control it. Okay, last thing is unaware. 50% of people who have diabetes don't even know they have it. And in African American communities, 12% of people have diabetes. And so if you know 8 adult people, you probably know somebody who's diabetic. It's just that common. But what I will tell you is diabetic retinopathy is currently the most common cause of blindness in working age people. There is no medical need for blindness due to diabetic retinopathy anymore. If your blood sugars stay in good control from earliest stages, if you're seen by an ophthalmologist on a regular basis, and you get appropriate treatment, if things start to happen, there is no medical need for anybody to lose their eyesight to diabetic retinopathy. But yet, it is still the most common cause of blindness in this country for working age people. And so, unaware, I bring this up is, you hear people say, if I had known there had been a scholarship, I'd have gone for it. If I'd have known that job was open, you have to know. You have to be around people to support your vision and your dream. And with diabetes, what I would suggest, being checked, it's not easy. Exercise, diet, I'm not going to stand here and say it's easy, but it makes a difference. And so I'm going to leave you with unaware. So, unprotected, get checked from a medical point of view, stay in prayer, make sure you're aligned. The unexpected, there are always going to be unexpected things in your life. Unclear, get rid of the baggage of cataracts. Unfocused, don't be distracted by distractions. Unfair, Yeah, there's unfair. And then unaware. So, I have already taken too much of your time. But I'm going to leave you with 3 takeaways. And the first one, President Harrison said so well, these are hard times. Love yourself. There's so much that's coming at us. Love yourself. And one of the best ways to love yourself is to take good care of your health. It really starts there because it's hard to do almost anything else if your health is not where you need it to be. So that's my doctor hat. That's the first takeaway. The second thing is I get to be the doctor of people's physical vision, but you get to be the doctor of your own spiritual vision and the spiritual vision of people who are around you. And so be careful. Don't step on your own vision. There are things that you can do to support your own vision and to be supportive of the people who are around you and their precious visions too. And then the third is my healthcare disparities hat. I can't walk away from the fact that as African American people, we are disproportionately affected by almost everything. This quote is one of my favorite ones. I'm going to read it. It's from Martin Luther King from 1966. And he said, of all of the forms of inequality, injustice in healthcare is the most shocking and inhuman. This country does not support our health and our well-being. We have to take responsibility for that. And as the dean brought out in his address on Tuesday, many of the reasons why we have these disparities, I'm sad to say they're political. It's housing, it's transportation, it's insurance, and that's why issue 1 is so important, because that's a route for us to be healthier as a race, as a group. And so what I would encourage you is to stay mindful. I think our challenges still exist. They have not gone away. But I'm not tired yet. And I hope you're not either. I really have taken too much of your time. Thank you very much.